Hello, friends. My name is Dr. Shounak Parekh. I'm the chief surgeon at Parekh Eye Hospital. And on this occasion of the World Glaucoma Week, I wish to share with you this patient awareness program on glaucoma, the silent thief of sight. What exactly is glaucoma? Glaucoma is also called as Kachbindu or Jamar. This is a disease basically affecting the nerve behind your eye. This is the nerve which connects the eye to the brain. Our eye works like a camera. So whenever you're seeing an object, an image is formed on the retina. This retina image then gets transmitted with the help of the optic nerve to the brain. So your eye sees, but your brain understands. Any hollow object has to have some pressure in order to maintain its integrity. Just like a car tire or a bicycle tire filled with air, our eye is also filled with fluid. And this normal pressure that is maintained within this eye is in the range of 12 to 20 millimeters of mercury. What happens to this fluid? How does it maintain this fluid? There is a body called as a ciliary body which produces this fluid. It passes through the pupil out through the angle of the eye. This circulating fluid is responsible to maintain the globe. It's also responsible for nutrition to the eye. Just like you have a water basin with a tap which throws water into the basin, and then an exhaust pipe or a drainage pipe which takes the water away from the basin. What if this drainage is blocked? Just like that, if the outflow drainage system of the eye is blocked, your intraocular pressure builds up. Gradually, it starts affecting the optic nerve. Now, this nerve is not a single fiber. It is made up of thousands and thousands of small fibers. And gradually, one by one, these individual nerve fibers start getting affected. What causes this glaucoma? That's a very difficult question. We've not yet understood this completely. Patients with glaucoma may be completely asymptomatic. If they have narrow angle glaucoma, they may have pain, headaches, blurry vision. They may have halos around lights. Some of them may even have nausea, vomiting, but most of the times they are asymptomatic. In the early stages of glaucoma, it may be difficult to even diagnose glaucoma. In moderate cases, a patient may see black spots or a little blurry vision, and in advanced stage, it may be permanent blindness. There are different types of glaucomas. I'm not going to go into the details of the types of glaucomas, but there are three main types: open angle glaucoma, narrow angle glaucoma, and something called as normal tension glaucoma. Here, the pressure of the eye is normal, but there are still changes suggestive of glaucoma happening in the eye. Your eye doctor, when you go for a normal checkup, may do certain tests to identify whether you have glaucoma or not. These tests may be measuring the eye pressure, having a look at the optic nerve head, doing a visual fields analysis, doing an optical coherence tomography to actually structurally measure the optic nerve head. These tests are important for two things. One is to identify glaucoma, and on follow-up, these tests are important to understand whether the disease is progressing or is it stable. Glaucoma can be treated by various means. The most common one and the initial therapy could be with just drops. Sometimes your doctor may prescribe laser surgery to make a hole in the iris, or sometimes to open up these drainage channels. Very rarely, and in advanced cases, you may have to undergo surgery. Who are the people at risk for glaucoma? If you are someone above the age of 40 with a history of using steroids like for your asthma, having high myopia, blood pressure, diabetes, or if you have a family history of glaucoma, or you've had a very bad eye injury, you are at a risk of glaucoma. To summarize, glaucoma is a poorly understood nerve pathology in which the eye pressure plays a very important role, and if not treated, it can leave permanent blindness. What is the take home message for this small short video? If you are above 40 years of age, myopic, on long term steroids, or you have a family history of glaucoma, you need to get your eyes tested with an ophthalmologist once in a year. And if you are a glaucoma patient, please use the medications that have been prescribed to you regularly without fail. A periodic eye check is extremely important, and you cannot take this for granted. Vision, remember, which is lost cannot be regained, but we can stop further progression with appropriate therapy. Timely diagnosis and appropriate treatment are the key to glaucoma prevention. I wish to thank Santin for the technical support to help me with this presentation. I am going to leave you with a couple of small hyperlinks which you may use to further understand this disease. We are at your service. Please feel free to contact us for any glaucoma related questions. Thank you.